Okay, good morning, ladies and gentlemen. Good morning. Happy Thursday. Today is Thursday, February 18th. We are still in Black History, African American History Month. I'm Dr. Selma Bartholomew. This is Dr. B. It's a pleasure to have our Thursday Legacy Ed News with you. And as always, we are excited to have an expert come and join and to share their expertise. So we will be talking this morning with Dr. Shawna Hudson from Rutgers University. I'll take a moment and do a formal introduction, but for those who are just joining us, happy Thursday and good morning to you. So the structure of the Legacy Ed News is I always like to give some updates around what's happening in education, what's happening that impacts our families and our communities around sometimes internationally, but certainly around our United States. So a couple of just quick points. First of all, if you have not seen that the National Center for Health Statistics and the Center for Disease Control and Prevention has noted that the life expectancy, a very sad number for Black and Latinos, were hit hardest as a result of the COVID-19. So the pandemic once again has shown the disparities in our society. So African American males are the largest decline, whose life expectancy dropped 3 years. Hispanic males also saw a large decrease in life expectancy with a decline in 2.4 years. We're also paying close attention to New York, and the US Attorney and the FBI is looking into the Cuomo administration's handling of COVID-19 as it relates to nursing home deaths. Noting that the numbers have been grossly underreported. They initially reported 8,500, but we're up to a count of at least 15,000. This is interesting as we talk today about COVID-19, and we have a chance to talk to Dr. Hudson about COVID-19 and its impact on communities of color. So we'll see where this goes, because everyone initially during the pandemic was, recommending our governor for the Academy Award for his presentations on the news. However, we are aware that our children and the impact within our schools and our communities have been hit extremely hard. I want to go to New Jersey because we do have Dr. Hudson, who is based in New Jersey. So Paterson City School officials announced on Wednesday night that they will extend remote instruction for at least another 2 months through the end of April. So if you're a mom, if you're a parent, you're a caregiver, we're going to April. Now schools end in June. So let's see if the superintendent, Eileen Schaefer, if she might change if that might change as the date approaches. Another piece for New Jersey, which is important in this context of COVID-19, if you've not seen, the Supreme Court has ruled that the teacher unions, and those who work for teacher unions are authorized to get paid leave as they work as union officials to support labor relations. So that's in New Jersey as well. Chicago has also been a place to watch, and in Chicago, it has been a fight with the Chicago Union to open up their schools. So they recently put up a plan that said that pre-K and the younger grades would start February 11th, and eighth graders is located for March 1st. I didn't see a plan for high school as of yet, and so if you are a mom or a parent of a high school student and someone who was supposed to graduate this year, the level of anxiety I fully understand. And finally, I want to point to Tennessee, because we are talking about STEM and science as well. And Tennessee Department of Education announced that they will give $7 million in grant to strengthen computer science pathways and STEM education to help more students be prepared for success after high school. And also Memphis superintendent has ordered schools to reopen on March 1st. So that's just a quick highlight to get you looped in and to get you, up to date on some of the latest news in education. Today's conversation relates very much to our work with our schools. So we are honored to have Dr. Shawna Hudson from Rutgers. It is an honor also, let me point out that it is African and Black History Month. So it's an honor to have a scientist and someone who is doing work and doing research at a very high level, at a university level, and also to be a principal investigator for an NIH study. So we're really honored to recognize you, Dr. Hudson, and to say thank you for joining us. So let me just get it right. So you're a professor and research for the chief division chief in the Department of Family Medicine and Community Health.
Yes.
And you're the founding director of the Center for Advancing Research and Evaluation for Patient-Centered Care at Rutgers Robert Wood Johnson's Medical School. And I also want to point out, which is very interesting as we talk about this research piece in COVID-19, is that you have a social work background. And most people just have, one mindset when they sometimes choose a field. So it's really great to show, to have you here to kind of show that career ladder. So before we get into your study and what it is that you're seeking to impact in very specific New Jersey communities, let me give you a chance to introduce yourself and share a little bit about your background.
Sure, no problem. Thank you for having me on this morning. So as you mentioned, my background is actually in the social sciences, and so I'm a sociologist by training, and really started out doing work in the liberal arts and looking at disparities of care as a graduate student, and I was really passionate about that, and had done work where we looked at self-ratings of health, and we know that those are sort of the best predictors of mortality, and that's where I sort of got bitten by the interest of really wanting to move into health and healthcare research. So I actually started out my career here at Rutgers as an undergraduate many, many years ago, and actually stayed here because our medical school and our university was actually merged with Rutgers University about 5 years ago. So I started out in the social sciences, and then I moved into the health sciences. And I also have an appointment in our School of Public Health in our Society and Policy Department. So a lot of the work that I do really spans, because we're working with individuals and people in their healthcare settings and in their communities. And so you really want to bring that social perspective on what's going on when the biomedical really meets people at the crux of disease. So I'm really excited to be here and talk to you about this.
Thank you so much, and congratulations to you for such a wonderful career journey, and and all of the work that you do on behalf of also our community. So you have a study at Rutgers that it's centered on COVID-19, and I picked up on it very early, and so we're happy to have you now at this phase around like the vaccine. So first, tell us about the study and what the intentions of it are.
Sure. So the study is really focused around outreach around testing and the importance of COVID testing. Even though we have a vaccine now, we know that the vaccine is really going to help people not contract really serious illness, but it doesn't stop you from actually getting COVID-19. So still important to be testing on a regular basis so that you know your status and when you need to quarantine and when you don't. So the background on this study is that I, as one of my many hats here at Rutgers University, I'm also the head of our Community Engagement Corps for an award that we received from NIH called a Clinical Translational Science Award. And so it basically puts basic science researchers who are in labs together with population health researchers like myself to really look at different types of issues. So when COVID hit back in March, one of the initiatives that was pushed out of the NIH was something called RADx Up, which is a rapid acceleration of diagnostics. And they really were focused on trying to get testing, trying to understand how the disease works, moving the vaccines forward very quickly. And part of that was also thinking about how do we reach our underserved populations? And so there was a call from NIH this summer that was focused around groups that were already funded and could have capacity to reach communities. And so we put in an application and we're funded to do the work of what we call New Jersey Heroes 2. So really quickly, or do you want?
No, I was going to ask if you could tell us what communities in New Jersey are you working with? Because I think when we say vulnerable communities, right, we might have a particular place in mind. So
right.
first, what communities exactly are you working with? And then we can learn a little bit more about the design and exactly how you're going about it.
Sure. So the communities that we're working with, they're actually right around our medical centers. So particularly focused around Newark and New Brunswick. So the counties that we're working with are Essex, Passaic, Union, and Middlesex counties, because those are the counties that are around our academic medical centers. And also, if you look at the state numbers for New Jersey, those are the areas where we have very, very high COVID, very, very high minority populations. And then also, if you look at social vulnerability and poverty, we also have concentrated poverty in those areas. So that was really sort of the impetus for this, was that it was sort of the perfect storm across COVID exposures, deaths, as well as then really wanting to address the issues in our Black and Latino populations.
And as you think about the study, I think what I want to first get to is, we know that the disparities, right? The disparities exist. So how have you been able to just go about being able to connect with the community? I know you're physically there, and it certainly helps to have you there as a leader, but what does it look like to actually go in and to connect with these communities? How do you do it? And I'm asking that because I do think that there's always this rhetoric around, right? The numbers show that we're not getting tested, and we're the, in terms of communities of color that are dying, but we need to be very solution oriented as well. And I don't think we hear that, right? So how exactly have you been going about connecting with these communities that you are seeking to learn from and to gain knowledge around the testing piece around COVID?
Really great question. So we actually, our question on this and our approach for the research really came from the community, because our staff members are in the community. And the way this particular project is set up is we're interested in the healthcare workers who don't get a lot of coverage on TV. So really people who are the ones who keep the hospitals running, who go out to your homes and do hospice care, our home health aides, our environmental service workers. Really, the reason that we came up with the study is that we have staff members who have family members who are working in those service areas. And they were talking about the concerns that they had as family members for the workers who were going out. And then also just, looking at what was happening on the ground and watching all of the news footage and saying, we're really not covered in that. And how do we actually start to think about it? So part of what we did as this project is that I work with a fantastic team here, and one of my co-investigators and other PIs on the project is Dr. Diane Hill, who runs our Office of Community Partnerships. She's based out of Newark. She has lived in Newark all of her life and had really strong relationships with community organizations. And so when this opportunity came, we were able to already talk because we had those relationships to begin with, and our staff members were telling us about their experiences, and it just became palpable. And we said, okay, we really need to do a project that leverages all of the different strengths that we have here, based on knowing who the people are, knowing the organizations. So we actually have a coalition of 20 organizations that we're working with across the different counties, and they range from organizations that are city-based through, like we are working with Hillside, and we also have county-based groups. We're working with the Urban League, the NAACP. We're working with PRAB, the Puerto Rican Action Board, and Aspira for our Latino populations. And then we also are working with groups that you would expect, like the United Way or the Maternal and Child Health Consortium. So wide ranging, and also making sure that we're working with groups who have a long-standing relationship in the community, where community members go and really feel that they trust it. So that's really sort of how we started with this project. It was not that, you know, the researchers came and said, okay, we're going to do this study. It was really a groundswell of, here's what's going on in our community. We've been doing virtual meetings. People are going out and they're distributing to the community, and then really hearing that, you know, this is a real concern and we need to address it. So that's really where that came from.
And for those who are in the audience, let me just clarify for them. So NIH is the National Institute of Health, and we also have it at the US level, National Science Foundation. So those are two big, you know, governmental agencies that definitely funds research. I'm curious, Dr. Hudson, what does it look like? So if somebody is in those counties, is it that they're getting access to testing? Are you then also asking them about, you know, how they've been dealing with COVID, and what do they need by way of support in this study? Or is it much more, okay, we needed to be able to coordinate all of these different organizations to meet a need within the community, and you're researching how that went about?
Right. So, so what we're actually doing is we have a different way of testing. So Rutgers University came up with a saliva-based test back in the summer that is now approved for use. And so a number of different counties across the state have been using that test, but it's not widely distributed. And so one of the things we were interested in is if we put together a program that would allow people to do this through the mail, so they wouldn't have to go on site. We've done interviews with about 100 different people across the counties now. And one of the things that we heard very palpably was that there are long waiting lines in some of the sites. People are concerned about having to take small children and be in those lines. And so is there a way to be able to do COVID testing that is actually going to be easier for families to be able to do this? And so we have the opportunity to do the saliva test and to do it at home. And we wanted to see if it's acceptable, and then also who needs to get that message out to the community. So we're working with healthcare organizations to work with their healthcare workers around this. And then we're also working with those community partners that I talked to you about. And we're moving the programs through those two settings in order to see what the acceptability is at this point.
But what's heartwarming about it, when I had a chance to read about it as you're talking about how to go about testing, is that it's so much more human, right? When people talk disparity and equity, they don't understand, like, okay, if you have a car, you can sit in the warmth of your car and wait on a line for testing. But if you don't have access to a vehicle,
exactly.
And then when they finally opened it up, like for example, in New York City, oh, they finally had the aha moment, we can work with churches and things like that to open up testing sites. If you're sick, I mean, literally you're being told to stand on a line for 3-4 hours with other people, like you're saying, who may be sick. And so, you know, we need to be able to know about these kinds of studies and what you're doing, because I think we can no longer just give rhetoric to saying that we want equity. We want to be able to have a more human approach to this, and to be able to say that, you know, individuals deserve the opportunity to, if they've worked all night, most of the time, like as you mentioned, if they're, you know, in the health field and as healthcare workers, the hours and the shifts are already long and exhausting. And now you have the stress of feeling like I may have this virus, and I now have to stand online for hours you know, to get a test. What phase of the research are you in? Will it continue now? I know we're going into vaccine, but is this something that you envision is continuing over the next few months? And then I also want to talk about the context of school. So tell us what phase you're in, if you don't mind.
So we had two phases of the study. We just wrapped the first phase up. So the first phase was really to have conversations with the community to understand what their needs were around testing and what they thought about this as a potential project. So we just finished interviews with 110 community members and healthcare workers. And so now we're in the process of developing our educational strategies around this and really getting ready to move into the next phase, which is testing. So we're just getting ready to move into the testing phase.
Okay. I think a lot of our audience is certainly parents and those working with schools, and no one knew what it is to lead in a crisis, to parent in a crisis. And so we know that our children are home, and especially with children of communities of color. The data is showing that we are even more reluctant to send our children, back to school. And the resources are not there, right? If you were in a private school in New York City, I go into the city sometimes, and you walk 96th Street, it's a regular day. Their kids are out, they close the block, 2 or 3 blocks, and they are able to play, they have on their mask. Some institutions have even bought new buildings,
right,
so that they can ensure that that their children are safe. And that is not the case, for our communities, in particular communities of color. And so, from an education perspective, yes, everyone is talking about the loss, the educational loss. I don't see our children as failures, and I don't want to ever take that approach of giving up. But I do think we need to be able to consider what are the implications as we look ahead at September, when hopefully schools do reopening, and several of them keep push the date back. And I also feel like they're not having a research approach to it, right? Like, you can test something, see what it works, and then sooner or later you'll get to a solution, whereas right now they're just closed.
right.
So how do you see this in terms of your study? Are there any implications for schools, and any implications that we may need to know about as we look ahead at September?
Yeah, so I think that, for our work, we really want to continue to stress that testing is important. So I know that on TV, everyone sort of talks about the vaccine is super important, and it is. I don't want to diminish that, but it's very important to continue the testing, because that's what's actually going to help keep us all safe. And so as we think about our kids going to school, this is really sort of individual decisions that parents have to make on their own, because we haven't had very strong guidance moving into this. I'm hopeful that with the change in administration, that we'll actually get some strong leadership from national to be able to help the cities and the counties and the states to really address this. But we're still in the phase where it's really about, mask wearing, good hand hygiene, and being able to have good ventilation. And I think that's where the questions are around the schools is hopefully kids are still in school. They're not in school the way we want to with remote learning, but we really want them to go back safely. And so having a testing strategy that also goes with all of those other pieces is going to be really important as we move forward.
And I haven't heard any pieces around, and I'm curious about, I know a saliva-based test, right? It's far more efficient, but I think that as they look ahead, there is not a discussion around, okay, this testing piece, because most schools have nurses, right? Have a medical, a member of the community. And, how can we now, if we are going to reopen schools and where the staff members feel safe and the parents feel safe? I don't have a little one anymore, but I would feel safe if I knew, okay, you know what, my school nurse, just as how they check for lice, right? Have a strategy to be able to check for COVID that is efficient, that is able to, that's trustworthy. And no one is having that discussion, which is why it was so important for us that I wanted to be able to, to hear about, what it is that you're doing at Rutgers, and to see what the implications are for our schools. Do you envision? Oh, go ahead. I'm sorry. Go ahead and comment.
No, I was just going to say, I think that that's really important at this point. And so being able to figure out the testing piece, I think, is really important for schools moving forward, because the CDC has issued the guidance that says it's really about those other three pieces. And those are very important, but we also need to make sure that people feel safe going into those settings. So.
And it's trust as well. For so many of our schools, what it looks like, what they say it is. For everybody who's listening, let me just say thank you and make sure to like and subscribe. Dr. B and our team at Legacy, we keep it honest. And what it looks like most of the time is they have staff members who come around, they have some number formula that they're looking, but the reality is, if you have a less number of kids in the building, so if you may have 20 kids when you normally have 150 and the data says, well, I'm only going to test, right? If there's 35 kids, I'll test 10 or whatever. Well, I can't trust you, right? And this is also about trust and being able to open up our schools. We have to be able to trust. The principals have to trust that they've been given a strategy. Parents have to trust. And I think that the testing gets to trust, to truly understand, what are the levels of COVID
and exposure,
herd immunity and all of those things. And I think for our communities of color, as I shared the data with Governor Cuomo, it's the constant break in trust. It's a constant break in trust. So we want to be able to know what should we be asking for as a community. So I definitely want to be able to say to our viewers, this is something we need to be asking for. What's the testing strategy and how do we benefit, from your research? So do you imagine, I think in terms of NIH, what are your expectations in terms of being able to say to them, these are our recommendations? Is that a year down the line? Do you envision being able to say something to the New Jersey community that we can learn from in the next few months? Or
so this is a pretty quick turnaround project for NIH. Usually those projects are around 5 years, and this one is 18 months. And so we started in September. We're expecting that the testing piece of this will go through the fall, and then we'll be writing up a final report. So this time next year would be the sort of the final on this entire study, but we actually are in the process now of writing up our findings from having spoken with the community and getting those ready for publication. So we're actually on a rolling timeline because we feel like you need to get this information out as it's relevant and as quickly and as timely as you possibly can. So we're actually doing everything that we can to move it forward now. So we'll final results by this time next year, but interim, we're going to be putting those out as we can. And we're actually in conversation with our community partners. So as we find different things out, then we go back and we talk to them and say, is this your experience? How do we need to sort of tweak what we're doing based on what we've been finding out? So really important to have that bi-directional discussion.
Can you tell our audience, where do we find information about your study? And certainly I want to make sure and invite you back and to keep, I guess, the flow of information. Because if you, for example, if you do any town halls on this, or if there's anything that we need to know, because I feel like if, I love Rutgers, I know the community of Rutgers. I'm a Fordham grad, but we won't. But there's, in Rutgers is in the heart of Newark, right? And
right.
Is, so that sense of responsibility and goes both ways, and in the Newark community as well as in Rutgers. So, but oftentimes we do this legacy ed news because we know that there are things happening locally that we want to share across our schools and across our communities. So just to keep people mindful of, okay, we need to be going back and paying attention to this, because our schools will not reopen and they will not be successful in reopening if we don't have a testing strategy. Because not everybody's going to take the vaccine. They're just now talking about vaccines for children. I am aware that there's a study that just came out in Israel regarding the treatment of the actual treatment of COVID. But testing matters when you're dealing with little ones, and as well as when you're dealing with adults, and people opt out. They opt out. And so we want to be able to really think about the context of testing as it opens, up to our schools. So they can find you at.
Yes, I had a typo in the first one, but if you search up the NJACS website, which is our New Jersey Alliance of Clinical Translational Science, we have a community link on there. You can click on our community link and find out about our study, how we're moving, and then also we have a bunch of different resources there for activities that are both local to New Jersey, but we also publicize other forums that are national around community issues in research and education. So njacts.rbhs.rutgers.edu.
Excellent. So for those, it's njacts.rbhs.rutgers.edu. And you can also look up just Dr. Shawna Hudson,
Yes.
and you will also find some articles and some things, and the articles have links to it as well. Dr. Hudson, are there any other questions we should be asking as we come to a close regarding this that you wanted to share about the study as we close down?
I think we talked about most of the really important things here. I think the main questions that people should be asking is, as you're thinking about education and your students, and if they're going back, making sure that you're making decisions that actually are in alignment with your core values. So if you feel it's safe, then you send your kids. If you have some concerns, then you think about that and you talk to people who are in the know locally who can help to allay those fears, and keep asking questions, because that's what's really key here, is to get more information to be able to make decisions.
I thank you. I also want to say to the audience that diversity matters, that, to be able to have someone from NIH who's a principal investigator and a woman of color, and to have individuals who are connected to community, who are in positions to be able to elevate the research questions that come from the community and represented, makes a difference. So thank you to you. Thank you to Rutgers and to your entire team. Please continue to stay safe. And for those who are watching, thank you so much. Please make sure and like and subscribe. We have a whole month of activities within our Partner with Legacy. On Sunday, we've got the Dr. Selma B Show. We release it at 10:30. The topic is transformations, 5 steps to get you started and reinventing yourself. On the 23rd, we're doing a special piece with the New York City Department of Education Office of Equity and Access around mathematics and also STEM. And we will continue our Legacy Ed News on Thursdays, as well as our webinars in community conversation. So thank you to our audience for listening. And thank you again to Dr. Hudson for making time and for sharing your expertise. And we will make sure and continue to point individuals and to point our community to your website over the next few months. And please do come back and share any major updates. And if there's any webinars or anything, town halls happening regarding it, we would like to know.
Thank
so
you.
Everyone have a great day, and I thank you so much.